Hello everyone, welcome to LAMP Auriculomedicine. For part 1, we shall be dealing with introduction, embryology, and innervation of the outer ear. The scientific foundations of body acupuncture have been established during the last 25 years. By contrast, ear acupuncture or auricular acupuncture, auriculotherapy, is still viewed by many as a therapeutic side issue despite its immediate and long-lasting effect. In a recent study representative of many scientific investigations, Professor David Alimi at the University of Paris has demonstrated by functional MRI that auricular reflex zones are directly connected to the corresponding brain areas. Needling the auricular point for the right thumb reached exactly the same brain area in the precentral gyrus as did direct stimulation of the right thumb, performed and measured separately prior to auricular acupuncture. The fact that Alimi was able to show by functional MRI such a precise and direct connection between an auricular reflex zone and the corresponding area in the brain is an impressive proof of the neurobiological effect of ear acupuncture. The fact that needling of the right ear stimulated the thumb area on the left half of the brain made it clear that the ear point representing a specific organ or body part must be needled on the same side of the body where the affected organ is. Ear acupuncture is becoming accepted throughout the world. The activities of LAMP AcuWellness Foundation have aroused the interest of many physicians, nurses, and acupuncturists. As a result, a considerable number of qualified LAMP auriculotherapists are now practicing in their respective barangays, much to the benefit of patients who do not get help from evidence-based conventional medicine. For several years now, interest in this special form of treatment has been steadily increasing among medical students and TCM instructors. The same picture is emerging everywhere around the world. Those who get to know ear acupuncture are quickly filled with the same excitement that gripped me more than 10 years when I had the privilege of learning auricular acupuncture from Dr. Lilia Aquino Marquez Palanca when it was still in its infancy. Thanks to the unflagging research efforts of Dr. Palanca and co-workers, this system has since matured into a concept for specific, highly effective treatment of many diseases, particularly in patients resistant to conventional treatment. After all, science is based on discovery, observation, and critical analysis, and thus, science creates knowledge. In view of this, the scientific community can no longer ignore the fascinating discoveries in auricular acupuncture and is currently working on a model that may explain and monitor its effects. Note: if steel needles are used instead of gold and silver needles, always needle the gold point because this is the point that needs to be stimulated. So as we continue, we shall be showing some maps that will have the following symbols. For example, in case of the diazepam analog point, the gold point would be on the left ear in a right-handed person, but on the right ear in a left-handed person. Exceptions are anxiety point, worry point, aggression point, nicotine analog point, the nervous lever point. Here, use silver point for steel needles. We shall be explaining this in more detail as we continue later. Ear acupuncture is an effective method for treating acute and chronic diseases without producing side effects. It therefore represents one of the most important complementary additions to conventional medicine today. Its main indication is certainly the treatment of pain, but a number of functional, organic, and mental disorders may be treated as well. Fortunately, this applies also to a number of diseases for which conventional medicine still has no cures to offer. For example, migraine and hay fever or allergic rhinitis. The origins of ear acupuncture can be traced back to the 4th century BC, when Hippocrates tried to cure impotence by bloodletting at the ear. It is also known that pain has been treated in ancient Egypt by means of ear points. Throughout the centuries, we find notes on similar treatments. The best known document in the European region is certainly the painting The Garden of Lust by Hieronymus Bosch in the 17th century, which shows the sciatica point being pierced by a needle. A second needle held by the Satan pricks the 2 points known as external genitals point and libido point. Ear acupuncture enjoyed a certain popularity also in China, but it fell into oblivion during the last centuries. Approximately 20 anterior and posterior ear points were known during the Tang Dynasty. The procedure then probably spread to Persia, Africa, India, and the Mediterranean area. However, there is no evidence that a comprehensive reflex system on the auricle, complete with representations of the entire body, existed. We owe it to the French physician Paul Noget that ear acupuncture has been rediscovered, and that this happened in a way that provided astonishing opportunities for both diagnosis and therapy. Noget has been able to demonstrate that all organs of the body are represented as reflex zones on the outer ear, the auricle or the auricula. The history of this rediscovery is as exciting as the entire therapeutic method itself. Around 1950, Noget discovered in some of his patients certain scars at a specific site on the ear. The patients told him that they had been treated for back pain by applying a red-hot needle to this side of the ear, with the result that the pain disappeared. We owe it to Noget's unreserved objectivity that he followed up on this phenomenon and studied it. He was able to reproduce the phenomenon successfully and interpreted the site on the ear as reflex localization, lumbar 5 and S1. Shortly thereafter, he realized that apart from this body area, all other sites or organs of the body must be projected on the ear. He also discovered how to demonstrate these sites. They showed an increased sensitivity to pressure if the corresponding region of the body was diseased. Subsequently, he recognized that active ear acupuncture points, those reflex points that indicate a pathological change in the body or are produced on the ear by such a pathology, have changed electrically, reduced resistance and increased conductance of the skin. This allows for objective measurements that are independent of the patient. Step by step, Noget established the auricular map used today. If the patient had the pathology, so that means there is inflammation, pain, he only had to search for the corresponding electrically altered point on the ear. For example, to locate the reflex sites of large joints or skin areas, he would simply apply a pain stimulus in the respective body region. An active acupuncture point would immediately be created at the corresponding site on the ear, and hence could be detected because of its sensitivity to pressure or its change in conductivity. Even today, this is still an excellent method for practicing on the ear or identifying a point that corresponds to a distinct structure of the body. There are two basic lines of thought in ear acupuncture, the French school and the Chinese school. They differ in the specifications of point localizations and in their diagnostic and therapeutic approaches. The present atlas describes the French school, the intellectual father and pioneer of which was Paul Noget. His famous students include, among others, the French psychiatrist Dr. Louis Bourdieu and the German physician Dr. Frank Bahr. Dr. Frank Bahr founded his own school in Germany and refined essential aspects of ear acupuncture. For example, obstacles to therapy, focus diagnosis in patients resistant to therapy, projection of body meridians onto the ear, as well as various test procedures for medications, trace elements, vitamins, and homeopathic substances. The approach of the French school is rather pragmatic and corresponds to the pathophysiological knowledge of conventional medicine. The point localizations have distinct, anatomically oriented assignments to pathologies of the body. The unambiguous relationship of the ear points to the corresponding parts of the body can be clearly demonstrated by electrical changes caused either by existing pathologies or by iatrogenic pain stimulation of the body. The present atlas describes the classic ear points, which are well known and anatomically well defined, as well as so-called functional points that influence the entire system. The lecture is not intended to replace hands-on courses and bedside teaching. It rather serves to deepen the knowledge and to provide a quick reference for the practice. In a right-handed person, the right ear is the dominant one, and the left ear is non-dominant. In a left-handed person, the left ear is dominant, and the right ear is non-dominant. The head of the embryo occupies the entire earlobe, the lobule. This area is indeed the projection zone of the most important parts of the head, the sensory organs, the brain, temporomandibular joint, teeth, maxillary sinus, the facial muscles. The embryo lies with its back, the spinal cord, against the posterior margin of the auricle, so the descending helix. Here are the reflex zones of the sensory and motor portions of the spinal cord. The embryo covers the concha with its abdomen. Here are the reflex zones of almost all intestinal organs, again in the upside-down arrangement. The embryo crosses its legs over the triangular fossa. This is the reflex zone of the lower limb. As a rule, the sensory portions are found on the front of the ear. So this is the lateral surface of the auricle, while the motor portions are found on the back of the ear, the medial surface of the auricle. When memorizing the different groups of points, it is of great help to inspect or palpate the different planes of the auricle. We shall call them the ear terraces. The lower terrace, the concha, contains the reflex zones of almost all internal organs. The terrace above, the scapha, antihelix, triangular fossa, is occupied by the reflex zones of the entire locomotor system. The uppermost teres, which is formed by the anterior, superior, and posterior margins of the auricle, the hillocks, contains the reflex zones of the spinal cord. As the first organ to develop to its full size and become fully functional, approximately 18 weeks after conception, the ear is also the first sense organ to begin working as early as the 8th week in utero. It is an extraordinary sensory organ that not only connects us with the world and each other through the power of hearing, but also serves as a unique and complete microsystem for the diagnosis, prevention, and treatment of virtually every human illness. The proposed theories on the embryological development of the human auricle is as follows. So first we have the lateral view of the original embryo in Carnegie stage 17. So this is 42 to 44 days. Letter B is a close-up of the auricular hillocks as described by His in 1885. And this one is a simplified version of the auricular hillocks. Numbers 1 to 3 have been described to be the first pharyngeal arch origin, and 4 to 6 as the second pharyngeal arch derivative. Letter D are the proposed theories of the embryological development of the human auricle as described by several authors. The fate of the hillocks as described by the authors are indicated by numbers 1 to 6. The first arrow represents the dorsal rotation of the second pharyngeal arch as described by His in 1885. The second arrow represents the ventral rotation of the first pharyngeal arch as described by Wood-Jones and Aichuan in 1934. So here is a more simplified representation of the embryological development of the auricle. We have the 3 germ layers. Number 1 is the ectoderm. Number 2, endoderm. And number 3, the mesoderm. The auricle is innervated by 3 nerves. First is the great auricular nerve, originating from the cervical plexus. It supplies the descending hillocks and the lobule. Here are the reflex zones of organs derived from the ectoderm, the skin, the nervous system. Second is the auriculotemporal nerve, a branch of the trigeminal nerve. It supplies the ascending hillocks and superior hillocks as far as Darwin's tubercle, the triangular fossa, the scapha, the antitragus, and the antihillocks, including the antihelical wall. Organs derived from the mesoderm are projected in this region of the ear: the muscles, bones, ligaments, heart, kidney. The auricular branch of the vagus nerve supplies the concha, the projection zone of organs derived from the endoderm, the internal organs, with the exception of kidney and heart. This zone extends to the projection zone of the sympathetic trunk, where the concha merges into the antihelical wall. This pattern of auricular innervation is easy to memorize and will be of great help when learning the reflex zones of the ear. Each of the 3 areas of innervation corresponds to one of the 3 germ layers: ectoderm, mesoderm, and endoderm, and is thus assigned to a clearly defined group of organs. Remarkably, the representation of organs on the auricle follows this pattern in almost all cases. For example, the kidney point does not lie in the zone of the endoderm like the reflex points of other internal organs. It is found beneath the ascending hillocks in the zone of the mesoderm from which the kidney is derived. Characteristics of auriculotherapy. Indications are used for a variety of disorders: easy insertion and manipulation of needles, economical and convenient for patients, few or no side effects, used for diagnosis and differentiation of syndromes, and used for prevention of disease. It is a very effective method for relieving acute pains and chronically stiff joints. Sometimes these have been cured within minutes. For some problems, it can be more effective than body acupuncture. Ear acupuncture is easy and safe for self-treatment and in healing groups. Organ diseases and glandular disturbances may respond less dramatically, but ear needling will always be very helpful as a supportive method with other forms of treatment. The main disadvantage of ear acupuncture is the requirement to find the most painful spot for it to be fully effective, and this is not pleasant for people who are very sensitive to pain. The best points are those that feel like an electric shock or like hitting a raw nerve. However, often the pain will be felt as being beneficial, especially because it usually decreases with continued needling. This pain may be considered as letting off steam or congestive energy from a target organ through the safety valve of an ear point. However, chronically weak organs may also benefit from ear needling if no pain is felt in the corresponding ear point. Generally, however, you may follow the rule, the more sore the point, the more effective the treatment. Sterilize a suitable needle in methylated spirits. Rub the ear with a cotton bud soaked in methylated spirits. Find the most tender spot in the appropriate reflex area of the ear by pressing with an angled probe. Insert the needle to about 2 millimeters deep. It must not pass through the ear. Gently move it around to find the correct depth and direction of the sorest spot. If it is very sore, do not move the needle. When the pain subsides, start to twirl it gently between thumb and forefinger. The less pain there is, the faster you may twirl the needle. If it is not sore anymore, move the needle to a different angle and twirl, and in this way gradually work around in a circle. If all or most of the pain is worked out, withdraw the needle and select another point. If it was sorer in a particular direction, insert the needle at a point 1 to 2 millimeters away from the first point in that direction and repeat the twirling and probing in different directions. Often the pain shifts around over a reflex area, and you must insert the needle and work out the pain in several points lying close together. When the ear point is sore and still in need of treatment, the needle will feel like sticking when it is twirled, while it will move freely when the tension is worked out. For treating chronically weak body parts that do not have sore ear points, select the appropriate point or area from the ear chart and twirl the needle rapidly. Instead of using needles, you may press the ear with the head of a pin or probe. Treat indicated organ points or wherever there is a tender spot. Press for 1 minute or more each day or whenever convenient. It will be very stimulating to the whole body to massage both ears thoroughly by rubbing them between the thumb and index finger simultaneously. Massage daily, pulling the ears at different angles is beneficial. Make sure that you equip yourselves with this kind of probe. This is a personal choice. I find that the angled probe is very, very efficient in really localizing ear points. You may want to also use press needles, which you could use on points that are considered to be deficient according to TCM. Or you might want the patient to look good by using colored ear seeds or even Swarovski ear seeds. Do not needle if the external ear is infected or inflamed. Ear acupuncture is contraindicated for pregnancy with history of miscarriage, and you have to be very cautious with patients who have weak constitution. Do not leave the seeds or tacks for more than 1 week. The locomotor system projects onto the upper terrace of the ear. That means the scapha, the triangular fossa. In principle, the sensory points lie on the front of the ear. So this is the lateral surface, while the motor points are on the back of the ear. This is the medial surface. The forceps method, according to Barr, is based on this arrangement. A gold needle in the sensory point on the lateral surface and a silver needle in the corresponding motor point on the medial surface. Body parts, organs, or anatomical structures belonging to the same region project very close to each other onto the ear. For example, the knee joint, popliteal artery, peroneal nerve. The entire vertebral column. Location: the vertebral column or spine projects upside down onto the entire antihelix. So you start at the post-antitragal fossa. This is also called the atlanto-occipital joint point, or the point C0, C1. Then you end at the coccyx point at the end of the antihelix, underneath the ascending helix, only visible with the helix unfolded, very close to the internal anus point. The outer aspect of the antihelical fold or reflection, the scapha antihelical wall, is variably expressed, which helps in subdividing the zone of the vertebral column into cervical spine zone, thoracic spine zone, and lumbar spine zone. Structures of the vertebral column. Like the various structures of a vertebra, the corresponding points lie close together on the edge of the antihelix. The small vertebral joints project slightly lateral to the edge of the antihelix, which is important for treating the very common blockages of the spine. The zone of paravertebral muscles and ligaments lies lateral to this zone of small vertebral joints. Points nearby. At the level of the transition from the upper third to the lower two-thirds of the antihelical wall lies the zone of nervous control points of endocrine glands. At the foot of the antihelical wall lies the zone of sympathetic trunk. This is the zone of paravertebral chain of sympathetic ganglia, with the reflex points for the nervous control of organs, for example, nervous liver point, and for the cervical ganglia, for example, the stellate ganglion point. Cervical spine is located in the inferior portion of the antihelix, the zone of cervical spine. The antihelical fold is sharply defined toward the conchal wall, like a tube with a small diameter. At the level of point C7T1, there is a distinct change. The sharp edge widens and becomes gently rounded, zone of the thoracic spine. The curvature of the antihelix also changes. Thoracic spine. The zone between points C7 and L1, with the antihelix being gently rounded, a sharp edge in the cervical spine zone, a steep cartilage overhang in the lumbar spine zone. Relative to the total length of the thoracic spine in the body, the segment of its representation on the ear is short. Lumbar spine. Start about 1 centimeter before the antihelix intersects the ascending helix. The soft rounding of the thoracic spine zone abruptly changes into a steep or lamella-shaped cartilage overhang. The latter represents the lumbar spine zone. And at point lumbar 5, sacrum 1, at the intersection of antihelix and helix. From here on, underneath the ascending helix, the sacral vertebrae are projected. C0, C1, or the atlanto-occipital joint. Location, post-antitragal fossa, easily detectable with the stirrup-shaped ear probe or the angled ear probe. C7T1, location, where the sharp edge of the cervical spine zone turns into a gentle rounding. Easy to find with the angled ear probe. T12L1, location, where the gentle rounding of the thoracic spine zone turns into a sharp overhanging edge. Easy to find with the angled ear probe. Lumbar 5, sacrum 1, lumbosacral transition. Location, on the antihelix at the intersection with the ascending helix. Coccyx, location, at the end point of the antihelix underneath the ascending helix. Easily palpable with the finger. All points of the sacrum lie on the antihelix hidden beneath the ascending helix. Sacral spine location. The sacrum projects onto the part of the antihelix that runs beneath the ascending helix. Start, intersection of antihelix and ascending helix. End, coccyx point at the end of the antihelix. The point is easily palpable with the finger. The thorax location. The ribs are represented on the scapha between the projections of the sternum and the corresponding vertebrae. All points of adjacent structures, the acromioclavicular joint, head of the first rib, sternocostal joints, are also found in this region of the ear. Ribs location. On the scapha, at the level of the thoracic vertebrae zone, the uppermost ear teres. Sternum location, on the scapha at the level of the thoracic vertebrae zone, uppermost ear teres, but slightly more lateral than the rib zone. Clavicle location, on the scapha at the level of the first rib at the uppermost ear teres near the shoulder point. Trunk muscles. All muscles project basically onto the zones of the adjacent bone structures. As always, the respective points need to be searched by using a point-finding device. The back muscles project onto the scapha near the zone of vertebrae. The anterior muscle portions, the abdominal and thoracic muscles, project lateral to the back muscles toward the rim of the helix. Pelvis location. The pelvis projects into the acute angle of the triangular fossa where the superior and inferior antihelical crura meet. Here are the reflex points of the hip joint, the pubic bone, important, for example, for complaints during pregnancy, the sacroiliac joint, and the points of the iliac crest, for example, for treating endopathy of the erector spinae muscle at the iliac crest. Pubic bone is lateral to the hip joint point. Important location for the hormone-induced painful loosening of the symphysis during pregnancy. Sacroiliac joint is near the lumbar spine zone, approximately at the level of point L2. A gold needle accurately inserted at this point can abolish blockage in the sacroiliac joint without manual therapy. Be aware of counter blockages along the vertebral column. Needle the corresponding points if appropriate. The ideal treatment also during pregnancy. Perineum. At the anterior edge of the palpable cartilage of the ascending helix at the level of the uterus point. Indications: pain after episiotomy. Episiotomy scars that have developed into a focal disturbance. The projection of the region between anus and genitals, the anterior perineum, is an important reflex zone on the ear because scars from an episiotomy frequently develop into a focal disturbance and this may cause resistance to therapy. Use a gold needle in such cases. The entire lower limb. The projection of the lower limb takes up all of the relatively small space of the triangular fossa. The points for the hip, knee, and ankle joints form an axis. The foot is represented perpendicularly to this axis on the uppermost margin of the scapha. In principle, all structures that belong to the same body region project also within the reflex zone of this body part on the ear. For example, the tendons, ligaments, and capsule of the ankle joint. The points are not identical but lie close together. The hip joint projects onto the very tip of the triangular fossa where the two antihelical crura meet. Also projected onto this area are all structures near the hip, such as the inguinal region, so for inguinal hernia, inguinal strain, the greater trochanter, the inferior portion of the sciatic nerve, and the bones of the bony pelvis with the sacroiliac symphysis. Knee joint is in the deepest point of the triangular fossa. It is therefore easy to find. The knee joint point may be used for guidance in finding the thigh and leg zones. Ankle joint. On the line drawn through hip joint point and knee joint point in superior direction, partly hidden by the rim of the ascending helix. To find this point on the rubber ear, insert the needle at the superior end of the lower limb axis, close to the rim of the ascending helix and perpendicularly to the scapha. Buttock, similar to sacroiliac joint point but occupying a larger area. Thigh, the area between hip joint point and knee joint point. Latero-anterior portions of the thigh, for example, quadriceps muscle, blood vessels, are represented on the ear in latero-inferior direction, while medial portions, for example, the adductor muscles, project in medial direction toward the ascending helix. Lower leg, the area between the knee joint point and ankle joint point. As with the thigh, the latero-anterior portions of the leg, for example, peroneus muscle, are represented on the ear in latero-inferior direction, while the medial portions project in medial direction toward the ascending helix. Foot. The foot projects perpendicularly to the axis formed by the representations of the hip, knee, and ankle joints, as in the body. The heel point lies near the coccyx point and is hidden under the ascending helix. The area of the toe points reaches underneath the ascending helix and is partly covered by the helical rim. The big toe point meets the thumb zone in the medial third of the helical rim. The dotted red areas represent hidden locations. The heel, near the coccyx point and therefore hidden by the ascending helix. The location of the heel point is a favorite question in the ear acupuncture exam. The dotted red areas represent hidden locations. The broken black line shows the continuation of the antihelix toward the coccyx point beneath the ascending helix. Achilles tendon, close and slightly inferior to the heel point. The dotted areas represent hidden locations. Toes, underneath the ascending helix and partly covered by the reflection. The big toe point meets the thumb zone in the medial third of the helical rim. The dotted areas represent hidden locations. Upper limb location, shoulder joint point. at the level of point C7. Elbow joint point between the lower third and the middle third of the line connecting shoulder joint point and wrist zone. Wrist zone, a larger area at the level of the knee joint point. The location of a joint point, or in general of a topographic structure in the locomotor system, includes all of the parts belonging to the structure, that is, the points for the respective tendons, ligaments, muscles, peripheral nerves, blood vessels are close together. In case of disease, the active point for the affected structure is searched for in the known reflex zone using a point finder. Large joints. Location. The upper limb projects onto the scapha. Shoulder joint point at the level of point C7. Elbow joint point, lower third between shoulder joint point and wrist zone. Wrist zone, a larger reflex area at the level of the knee joint point. Shoulder joint. The shoulder joint and its adjacent structures, the clavicle, the scapula, project, as may be expected, approximately at the level of point C7 onto the scapha. Beginners often search for the shoulder joint point too far down in the direction of the lobule. The active points for all pathologically altered structures of the shoulder region should be searched for by starting from this point. For example, irritation of the rotator cuff, isolated endopathy, irritation of the bicipital tendon, frozen shoulder, inflammation of the acromioclavicular joint. Acromioclavicular joint. Location at the level of point C7 near the shoulder joint point. The joint is commonly affected by disorders of the shoulder. Elbow joint. Location on the line formed by connecting the shoulder joint point with the wrist zone while following the gentle curvature of the scapha in superior direction. On the intersection of this line with the line tangential to the antihelix in the region of the lumbar spine zone. Wrist. The wrist projects onto a relatively large area, lateral to the knee joint point, midway between the descending helix and the superior antihelical crus. A horizontal line through the knee joint point leads to the wrist zone. The metacarpal bones and the fingers project onto the remaining area toward the edge of the ear, the body of helix. Upper arm, the area between shoulder joint point and elbow joint point. Forearm. The forearm is represented between wrist zone and elbow joint point, with the radius projecting medially and the ulna projecting laterally near the body of the descending helix. Finger. The metacarpal bones and the fingers project onto the area between the wrist zone and the body of the helix. For finding the reflex zones of the fingers, it is helpful to know that the thumb zone meets the big toe point beneath the medial third of the helical rim. The points for fingertips and fingernails, like those for the tips and nails of the toes, are partly hidden by the rim of the helix. The palps of the fingers project onto a relatively large area of the ear, corresponding to the large area of representation in the brain. Metacarpophalangeal joint of thumb. Location between the points for the head of the first metacarpal bone and the base of the proximal phalanx of the thumb. Carpometacarpal joint of the thumb, between the points for the first metacarpal bone of the thumb and the wrist, the trapezium bone. Important location for treating arthrosis of the carpometacarpal joint. To conclude this presentation, let us take a look at the somatotopic representation. The lobe would represent the face and the sensory, antitragus, cranium, and the brain. The internal organs in the concha. So for the thorax, we have the inferior or cavum concha, abdomen, superior or simba concha, and the digestive organs around the helix crus. The spine on the antihelix, the upper limb on the scaphoid fossa, lower limb on the upper antihelix crus. For the triangular fossa, reproductive enchaînement for the Chinese, the lower limb for the French. Thank you very much for your attention.